Three-time Olympic medalist Tori Bowie died earlier this week, and autopsy reports show she died from complications related to childbirth. And the CDC reports Black women have the highest maternal mortality rate in the U.S., something Jasmine Brooks, as a local Black doula in the rural area, knows all too well. Jasmine, thanks for joining us this afternoon. When we're talking about this alarming trend, we're talking about the mortality rates. How alarming is this trend, and what's being done to address it?
Yeah, I think a lot of folks are having great conversations. Obviously, more work needs to be done as far as implementing practices, policies around like what exactly is causing, this disproportionate impact on Black women and Black community members.
When you hear this high-profile case of a star athlete, an Olympic athlete, dying at home, this is obviously something that gains a lot of headlines, but it's something that you can use. I don't even know how we use this case to help other women.
Yeah, I mean, condolences to her family, because this is, not new. It's not unique. A lot of families are dealing with this. A lot of loss has happened, and it just shows that wealth and status really doesn't allow for folks to, run from it.
Yeah.
Knowing a little bit more about eclampsia, pre-eclampsia is super important. Knowing about how to navigate healthcare resources, relying on your community, offering support to pregnant individuals, having more conversation. I think there's so much joy in pregnancy, right? We are celebrating the families with baby showers and getting the room ready. And we also have to talk about the real hard things too, about how do we know more about childbirth, and how do we, trying to prevent these things from happening by getting a doula, by, creating more team members around you that can really provide that support.
Well, let's talk about your role as a doula.
Yeah.
What is that? So some people are familiar with that. Some people, this might be something completely new to them.
Yeah, doulas are great. So we provide a lot of emotional, mental, informational, physical support during and after labor. And even prior to that, we're providing a lot of childbirth education. We're helping you prepare your body, getting you connected to resources. As we know, there's so much out there. What do I have access to? What is, specifically important to me and my family? A doula does not take over the space of your support system. So your partner, your mom, your parents, they're all going to be a part of your birth team alongside us. And we really are working to be a part of that team and providing that support and knowledge so that you know how to ask the right questions, you know what to expect before you arrive. And even during, labor, we are intervening, we are, helping folks see things that they may miss, whether it be the laboring person or the providers.
Sure. I mean, you don't know what you don't know.
Exactly.
And for people going through pregnancy for the first time, there are so many questions. What sort of things are you hearing from clients that you work with?
Yeah, I mean, something that Bowie's agent said was she was very afraid. I think that's always the first thing I hear when a client comes to my door and having conversations with me, even outside. I just met with a pregnant person, and they're very afraid, and really helping to dispel the myths and the stereotypes and the challenges that create barriers for them to really talk with their providers to find the right providers that support them. But they're also really excited. They see a joy in, having a baby, expanding their family, navigating the challenges of transportation and income and family dynamics and change. I think a lot of them are wanting to find that right spot to be the best parent they can be, and really helping to usher them through that is super, super important as a doula.
So having doulas in rural Iowa,
Yeah.
it can always be a challenge for rural healthcare, but also having doulas that look like the women and families and men that they're helping. So important.
It is, it is. The travel is super important. We know that going to hospitals and clinics can be very challenging. We're seeing a lot of closures, and so folks are having to travel very long distance, and so providing that support is very important, because we can have those conversations that families, providers miss. We are right there all the time on the phone with them, talking about their worries, talking about their strengths and their joys, and we're really catching a lot of things that could, prevent complications and challenges in the future.
People who want more information about doulas, about what they do, the resources that are available, what's the easiest way people can learn more?
Yeah, I mean, there's so many doula organizations. We have Sacred Health Doulas, we have Central Iowa Association, we have the Iowa Baby Lady. We have so many doulas. If you are looking for a free doula and you identify as African American or someone needing a doula support, you can always contact Every Step. We have a big program that's across the state to really help provide support to families of no cost.